Ergonomics and Injury, the cost of one wrong move in healthcare. In healthcare, we're trained to care for others, but what about ourselves? Every day, nurses, care aides, lab techs, and administrative staff put their bodies on the line, lifting, twisting, standing, moving. And the truth is, it's often done in ways that strain the body, wear down joints, and lead to long-term injury. One wrong move can be all it takes to end a career. And yet, it keeps happening. Welcome back to the channel where we focus on practical, real-world workplace safety. In this episode, we're looking at one of the most common and most overlooked causes of injury in healthcare: poor ergonomics. Whether you're pushing a medication cart, typing into an EMR system, lifting a patient, or restocking supplies, how you move matters. Let's talk about what's going wrong and how to fix it. Musculoskeletal injuries are one of the leading reasons healthcare workers take time off. And they're also one of the most preventable. These aren't freak accidents. They're repetitive strain, poor lifting form, awkward postures, and physical overload. And because these injuries happen slowly, they often get dismissed until they become chronic. A nurse in New Zealand shared her story publicly. Years of lifting patients without adequate support or equipment led to a spinal disc injury that ended her bedside nursing career. It didn't happen all at once. It built up, one shift at a time, one lift at a time, until the damage was permanent. It's not just about nurses either. Administrative staff suffer from carpal tunnel, neck strain, and eye fatigue from hours of data entry and screen time. Lab techs and pharmacy workers spend hours in standing positions, often reaching and twisting in tight workspaces. Environmental services staff push heavy carts through crowded hallways with uneven flooring. In every corner of healthcare, the physical demands add up. One of the key challenges is that many healthcare workers don't see these injuries coming. The job becomes a rhythm, and people adapt their movements to get through the day. But those adaptations, like twisting instead of turning, overreaching instead of repositioning, or skipping equipment because it takes too long, become habits. And those habits lead to injury. Identifying and addressing ergonomic hazards is crucial in healthcare settings. These hazards can lead to serious injuries if not properly managed. Let's break down some of the most common ergonomic hazards in healthcare. First, patient handling. Whether it's transferring someone from bed to wheelchair, repositioning in bed, or catching a fall, the human body is unpredictable. Without assistive devices like ceiling lifts, transfer boards, or gait belts, and the proper training to use them, staff are forced to rely on strength and instinct. And that's when injuries happen. Then there's workstation ergonomics. Desks that are too low or too high, chairs without lumbar support, screens that aren't at eye level, poor lighting. All of these lead to repetitive strain injuries, eye strain, headaches, and back or neck pain. When you multiply that across hundreds of hours each month, the damage compounds quickly. Even supply storage can be a hazard. Heavy items stored overhead require awkward reaching and create fall risks. Supplies stored too low force constant bending and squatting. And when areas are cluttered or poorly designed, workers can't access what they need safely. Some hospitals are making ergonomics a priority. A regional hospital in British Columbia brought in ergonomic consultants to evaluate every department. They made small, inexpensive changes like height-adjustable desks, lighter carts, and better grips on supply bins. They also trained staff on posture, micro breaks, and safe movement techniques. The result? A 35% drop in reported musculoskeletal injuries in under a year. Another example, a rehabilitation clinic in Boston implemented a proactive ergonomics program. Every new employee received training during onboarding, and managers were taught to conduct monthly mini-assessments. Staff were empowered to suggest ergonomic improvements, no red tape required. Over 2 years, their workers' comp claims related to strain injuries dropped by nearly half. Overcoming barriers and implementing solutions. But there's still a long way to go. One of the biggest barriers is time. In fast-paced healthcare environments, staff often skip the safe choice because it feels slower. That means ceiling lifts gather dust, carts get overloaded, and posture goes out the window. So how do we shift that culture? It starts with leadership. If supervisors reinforce the message that safety comes before speed, workers will follow. That might mean reevaluating shift structures, staffing levels, or task priorities. It also means encouraging workers to report pain early, before it becomes a major injury. Ergonomics is also about policies. Are there protocols in place for patient transfers? Are adjustable tools and equipment available and maintained? Are there clear guidelines about maximum lift weights or limits on overtime that could lead to fatigue-related strain? Technology can help too. New innovations include exoskeletons for lifting tasks, wearable posture monitors, and AI-driven ergonomic assessments using video analysis. While not every facility can afford high-tech solutions, even low-cost interventions, like rearranging supply shelves or updating chairs, can make a big difference. Let's not forget training. Many injuries happen simply because workers weren't shown the safest way to do something. Ongoing ergonomics education should be part of annual safety refreshers, not just a one-time module during orientation. Make it visual, make it hands-on, and most of all, make it relevant to their actual tasks. Another overlooked aspect: mental fatigue. When people are stressed, overworked, or emotionally drained, their awareness drops. They lift without thinking, they reach too far, they rush to finish. Supporting mental health isn't just good for morale, it's critical to preventing physical injury. We also need to talk about how this impacts different roles. Nurses, aides, techs, admin, each group faces different ergonomic challenges. A one-size-fits-all approach won't work. Safety committees or working groups that include representatives from each department can identify risks and solutions more effectively. In conclusion, addressing both physical and mental aspects of workplace safety is essential. By understanding the specific needs of different roles and fostering a supportive environment, we can significantly reduce injuries and improve overall well-being. Let's work together to create a safer, healthier workplace for everyone. At the end of the day, ergonomic safety is about respect. Respect for the worker's body, respect for their long-term health, respect for their ability to do their job well without suffering silently. If you've ever felt the toll that healthcare takes on your body, you're not alone, and you don't have to accept it as inevitable. Start the conversation. Advocate for change. Ask for the equipment. Use the tools. Speak up about pain. And if you're in leadership, listen. Comment below and share what's working or not working when it comes to ergonomics in your workplace. Let's crowdsource solutions and learn from each other. And if this video helps spark an idea or a conversation, give it a like, hit subscribe, and send it to someone who needs it. Until next time, take care of your patients and take care of your body.